Nipple areola sensation loss, as well as complete nipple areola loss, where the nipple or areola dies, are feared complications after breast augmentation, breast lift, and breast reduction. If you plan to proceed with one of these procedures, you must be willing to accept this as a possibility. After breast augmentation, some studies have shown up to 4% of women have decreased sensation persisting at 12 weeks after surgery. With breast augmentation, however, most women regain sensation over time, and complete numbness is rare, but it can occur. For breast lift or breast reduction, however, literature rates of nipple areola sensory loss can be as high as 20 to 30%. It's also important to note that some patients after breast reduction may actually gain sensation, 7% in some studies. The risk of nipple areola loss or nipple areola death is much higher with breast lift and breast reduction compared to breast augmentation. When we move the nipple areola, we keep it alive with sensation based on known blood vessels and nerves. So, if we know where these blood vessels and nerves are, why would we have risk of sensation changes or loss? Well, there's many reasons, including when we move the nipple areola, we don't actually see the nerves and blood vessels. Our approach is based on anatomical studies, so there's always risk to these structures. Injuries to the blood vessels and nerves can occur with small lifts, but these risks increase the larger the lift required. Also, everyone has unique anatomy, and yours may not be the same as someone else's. Some patients who need a very large movement of the nipple areola need a free nipple graft. This is where we take the nipple areola completely off, reconnect as a graft like a skin graft. These patients will certainly lose sensation, can have color loss, and may completely lose the nipple areola. Other factors that can contribute to risks include, but are not limited to, health status that can affect blood flow to the nipple areola, nicotine use. This is critical as this can lead to microvascular circulatory concerns and nipple areola loss. See our video series on nicotine use. For patients desiring augmentation with lift, most of the time I'm completing this in a single stage. However, select patients need it completed in 2 stages for safety. If you have sensation changes, give this time. Although you may never regain sensation, nerves can take a year or even longer to fully recover. If you have nipple areola loss, which can be partial or complete, this can be quite stressful, but there are options. Typically, you wait for complete healing, and the options include nipple reconstruction and areola tattoo. These options can help improve your outcome, but be prepared for this process to take time. It's important not to rush the process, as that can compromise final results. Overall, patients tend to do very well after augmentation, breast lift, and breast reduction, but you must be willing to accept that nipple areola sensation changes can occur, and there is risk of nipple areola loss.